Imagine a world where incurable diseases can, in fact, be cured. Where failing hearts can be strengthened without surgical transplants or donor organs. Where victims of devastating diseases like ALS can receive effective treatment and hope. This is the promise of regenerative medicine. Science has long known that the human body responds to injury and disease by attempting to heal itself. Regenerative medicine accelerates this natural healing process by harnessing advances in biology, immunology, and other sciences to restore health and function to damaged tissues and organs.
Regenerative medicine is truly a game changer.
If we can take a patient's own cells and get them working on the patient's problem, we could have a tremendous amount of impact on the care of medicine.
This is something we need now. We see, this is the end of the line for a lot of patients for some wounds, and I think this is something that's very easily translatable to the bedside.
Recognizing the vast potential of this emerging field, Mayo Clinic has established the Center for Regenerative Medicine. The center serves as a catalyst for the entire Mayo enterprise, advancing the practice of regenerative therapies across medical and surgical specialties, educating the next generations of physicians and scientists, and addressing patients' unmet needs with next-generation solutions. Many patients are already benefiting from proven regenerative therapies. For example, physicians use materials from the patient's own body to assist in the healing process. Dr. Rafael Sierra uses a similar approach when treating certain patients with osteonecrosis of the hip. Osteonecrosis is essentially the death of bone material, sometimes caused by the use of chemotherapy in cancer patients.
It's a very simple procedure where we take bone marrow concentrate that's obtained from the iliac crest of patients with osteonecrosis, and through a hip decompression, that's a trocar and a sleeve that's placed into the femoral head, we're able to deliver these cells into the dead bone with the hopes of regenerating, but most importantly to improve pain. These patients have a lot of pain, and the pain improves with the decompression procedure, and it seems to be even further improved with the injection of the bone marrow concentrate. This is a step towards trying to hopefully treat a problem that for the most part has been untreatable for many decades.
These regenerative therapies are meeting patients' needs today, and Mayo physicians and researchers have many new ideas in the pipeline. In another trial, cultured stem cells are being used to heal painful perianal fistulas in patients with Crohn's disease.
We have about 500,000 patients in the U.S. who have Crohn's disease. About 20% of those will have perianal fistulas, and we really have no good treatment currently for that problem. So this trial is really designed to help wound healing in those patients who have this bad problem of fistulas. Now in surgery, we have a lot of patients who have trouble with wound healing. So I'm very excited about the ability of regenerative medicine to help patients that we struggle with on a daily basis, patients with terrible infections, patients who've had burns, patients who've had major cancer surgery and have huge tissue loss, trauma patients. All these patients may benefit from a program that allows the body's own cells to regenerate and replace that normal tissue in patients that have tremendous tissue loss. So it's a very exciting area for me as a surgeon in an area that I struggle with almost on a daily basis.
Dr. Stephen Moran is researching how regenerative medicine can help heal wounds to skin and tendons through the use of spherically engineered bioscaffolds.
Chronic wounds is a huge issue in the United States. It's a $4 billion cost to the American public in terms of managing these things. And they develop from all kinds of different traumas, whether it's burns or chronic wounds, diabetic wounds, patients that have poor blood supply to the tissue. And what we've been working on specifically in our lab is a type of scaffolding that not only causes new skin to grow, but also increases the blood supply.
Another promising Mayo trial works with patients suffering from amyotrophic lateral sclerosis, also known as ALS or Lou Gehrig's disease. This devastating disease destroys nerve cells in the brain and spinal column, eventually leading to paralysis and death. Once again, a Mayo team is testing a cell-based therapy, using stem cells harvested from the patient's own body fat. In the lab, these stem cells are isolated and multiplied, then injected back into the patient's spinal fluid.
We are using mesenchymal stem cells, also known as MSCs, to treat ALS. The hope with this therapy is that MSCs will help protect the neurons that are there. So the idea is to slow the disease course, hopefully to the point where it stops, but any improvement in the disease course would be great from our standpoint. So the thought behind how MSCs can help in ALS is twofold. One, the MSCs are known to release growth factors that are protective for motor neurons. The second aspect of MSC therapy is that it changes the immune system, and it's become really more clear over time that the immune system does play a role in the progression of ALS. Our current therapy with regards to stem cells and ALS is really of a neuroprotective strategy. We're trying to keep the cells alive as long as possible. I think the future for regenerative medicine and neurology is to be able to replace the neurons, actually bring in new neurons that are able to make connections and improve function over time.
These examples illustrate that regenerative medicine has the potential to transform the practice of medicine, meeting patients' needs across ages, lifespans, and disease types. And this is just the beginning. There is so much more that can be done.
Regenerative medicine is not based on a singular technology. In fact, a number of technologies are being developed. We are speaking of a regenerative medicine toolkit as it's being evolving. And it's not only focused on one patient population. We're really able to address conditions from very young, the infants, congenital diseases in other words, all the way to our aging population and degenerative diseases that come with age, such as heart failure, diabetes, cancer, neurological disorders. What we have already seen are significant successes with regenerative medicine. Let's say in hematology, patients with leukemia, lymphomas, myelomas are treated today through regenerative procedures very differently than when I was a medical student. We're truly able to speak of cures in many of the cases that patients have been treated. It's truly an exciting field. It's an exciting field because we are first of all learning how our own body heals, and we are leveraging that understanding. We're harnessing essentially the innate ability of self-repair to indeed help the body heal from within.
Curing the incurable with low-impact, non-invasive therapies, creating a better quality of life for patients of all ages, providing hope. At Mayo Clinic, we believe that this is the promise and the future of regenerative medicine.